We are kickstarting today's session with the special guest from Singapore's Economic Development Board, Lisa Ooi. And she's going to walk us through Singapore's unique positioning within Southeast Asia as the innovation hub with specific focus on healthcare. She has produced a very fascinating presentation, which I look forward to listen to. And please use the Q&A function for questions to Lisa, and we'll be happy to take them at the end of the session.
So thanks very much for inviting me to be here today to share about the health tech ecosystem view that we have at the Singapore EDB. So my very first slide would be to introduce who the Singapore EDB is. So EDB is a statutory board within the Ministry of Trade and Industry here in Singapore. And our goals are sustainable economic growth, as well as job creation for Singapore. So how we do this are some of the key roles that are highlighted in the brown box on the left. We attract foreign direct investments, we grow selected industry verticals, of which healthcare is one, and we also enhance the business environment. And I think within part of that is actually transforming some of the existing industry players in Singapore to be more productive and more sustainable. The manufacturing and tradable services sectors that EDB is responsible for make up about 1/3 of Singapore's annual GDP. So together with our partner agencies, Enterprise Singapore, A-Star, as well as JTC, healthcare is a specific area of focus for us. We have, over the past decades, actually demonstrated a strong and sustained commitment to the healthcare industry. And the healthcare sector in Singapore is localized in two main parts of the island. One on the west side of the island, where we have a very large Tuas biomedical manufacturing park, and another sector in the southern part of the island, where we have the Biopolis, which is like the Bio City. And EDB was one of the agencies that was involved in building this in the early 2000s. And there we have public and private sector players doing activities in the area of research and development for the biomedical sciences. And as part of the sustained commitment to growing of this sector, the Singapore government has also committed $25 billion for public R&D funding, of which a subset of that goes to the healthcare sector for 2021 to 2025. So this is in a snapshot is EDB and the agency from which I'm from. Next slide, please, Anna. So now I'm going to shift gears from talking about EDB into the area of health tech, which is, I guess, an area of interest for the participants of this webinar here today. So why are we interested in health tech? Maybe if we take a broader view on the next slide, it would be because the healthcare sector as a whole remains to be one of significant resilient growth. And we can see this both in terms of the global numbers as well as the Asian numbers. So if you look at the global numbers, the red globe on the left, the healthcare sector is reporting a very healthy CAGR growth of 5.6% and will grow up to about $2.7 trillion market by 2025. If you zoom specifically into Asia, that CAGR actually doubles. And Asia is expected to be the largest healthcare market in the world by 2028. And these are sourced from Frost & Sullivan. So as to why healthcare is such a promising, growing, robust market, it's really driven by some of the drivers that are shown in the bottom half of the slide. So people in general are getting older. I think the populations are aging with an increase in life expectancy. For example, in Asia Pacific, 2 in 3 people would be above 60 years old by 2050. I know I will be, and I guess I would not be in a minority then. There's also increasing incidence of chronic and non-communicable diseases such as cancer and cardiovascular disease. And in particular, I think diabetes is a disease area that has greatly impacted Asia Pacific, and a 38% increase in APAC diabetics from 2017 to 2045. And lastly, in addition to having an older population and one perhaps with a higher disease burden because of the age, this is also a part of the world where we have seen a very strong growth of an emerging middle class with rising income levels. And this also means that this would be a population that's able to spend on the area of healthcare in view of the aging as well as the higher disease burden in the population. So next slide, please, Anna. So in view of this, we've actually seen recently a change in the attitudes towards healthcare. I think in the past, people would typically think about healthcare when they fall ill, but increasingly there seems to be an interest in preventative health, preventing people from falling into a state of disease in the first place and maintaining that healthy state. There's also an increase in terms of convenience and ownership of healthcare. So in the past, you might defer a lot of decisions, and I think the tracking of your health history to some of the healthcare providers, but increasingly, I think individuals are more interested in keeping themselves healthy, in owning their healthcare data, and also in choosing among a plethora of healthcare options, what's most convenient and best for them. And when we zoom in into our part of the world, where we are now in Singapore, as well as nearby in Indonesia, we also see the surge in the use of telemedicine in 2020. And this is in no small part, I think, also due to COVID and the current pandemic in which people might go online to seek medical care. And I think the increasing rates also demonstrate an increasing acceptance of some of these new virtual digital means by which healthcare is delivered. So in addition to the growth of the healthcare sector, changing attitudes towards healthcare, the next slide demonstrates the Singapore government and some of the healthcare policy shifts that Singapore is undertaking. So the Ministry of Health has recently outlined 3 beyonds. The first beyond is beyond healthcare to health. And this is very similar to that train of thought that we had talked about people trying to keep in a healthy state rather than treating disease when you actually are ill. There's also beyond hospital to community. And I think this is, again, a very salient point in our current pandemic, where we're trying to right-site care of, for example, COVID-19 patients who, in the Singapore context, by and large, are mild or asymptomatic. And so how do we ensure that they are well taken care of beyond the acute hospital care setting to perhaps within the community? And lastly, beyond quality to value. So in the past, there's this constant look towards providing the best quality healthcare, but increasingly there's an understanding about the value and how much the healthcare would cost in order to be delivered. And how do we strike that balance between not just quality, but outcomes as well as value? And I think undergirding these 3 beyonds actually is understanding that data and digital technologies would really be important in helping us move through these 3 beyonds. So how can we, like a car with a sensor as to what might be malfunctioning, how can we use data about our healthcare state to enable us to stay in a state of health rather than in a state of treating a disease? How can we, through digital technologies and data and sensing equipment within the community, enable healthcare professionals to be able to monitor remotely the health state of an individual and be able to step up the care into a hospital where needed? And data and digital technologies is also really important in terms of capturing outcomes. So after a person falls ill, after you render an intervention, how do we make sure that that outcome is actually captured? And I think some of the data types that's really important in terms of putting together this comprehensive view of an individual's healthcare are some of the data types that are outlined on the right side around the circle. There is family history. That's obviously some history taking that's often taken when we go to the doctors. Genomic information, as the cost of genomic sequencing plummets. Increasingly, we would have that genomic data. And how do we make sense of that data in view of all the other data types that are within our reach? There's lifestyle data. And for this, increasingly with wearables, with healthcare trackers, we are paying close attention to how much activity we get, what kind of meals we take, and how does that influence health? Medical, and I think here we refer more to your electronic medical records in terms of the medications that you take, the diagnosis that you have, the treatments that you received. And then lastly, environmental, from something like the air quality how does that and a host of other environmental factors, together with all the different pots of data that's highlighted in this circle, help advise you on how you can take better control of your health state? Next slide, please, Anna. So in view of these area of healthcare, which is obviously a robust, promising industry sector that the Singapore government is focusing on, and in particular, the directionality of healthcare into incorporating more and more data, then health tech is another sector that the Singapore government is very interested in looking at. So the key verticals, I think here are highlighted in terms of what we have focused on in the past. There's the biopharmaceutical sector, the medical technology sector, the consumer sector, and I think this extends into the healthcare realm, for example, with some of the wearable tracker devices that we have. And now this new industry vertical in terms of incorporating data into healthcare is the health tech sector. And I think Ned, who did this slide, actually put a horizontal there because he wanted to emphasize that actually a lot of the pharmaceutical, medical technology, and consumer segments within healthcare actually are enabled by technology. So you can see that depending on how you define healthcare, it can be a vertical, but it can also be an enabler, a horizontal that uplifts all the other three healthcare verticals. Next slide, please, Anna. So I have covered who EDB is, gone a little bit into why we're interested in the health tech sector in view of the CAGR, the growth, the fact that it's transforming healthcare. And now I'll zoom in into the Singapore health tech sector as to how this particular sector in Singapore is gaining momentum. And next slide, please, Anna. So this actually is a study that was partnered with Galen in 2018, I think, with EDB partnering Galen to try and understand and scope and characterize the health tech ecosystem in Singapore. And very happy to note that the CAGRs that we saw in the healthcare sector in general, beyond health tech, is actually a multiplied in the health tech ecosystem. And right now, at a snapshot, this is a non-comprehensive snapshot of some of the players that are moving into the health tech ecosystem here in Singapore on the left. But a lot of them actually are substantial employers. At our estimate, we have about 250 health tech companies in Singapore, employing about 2,000 employees, a lot of different startups, and increasingly we see partnerships between the multinational companies and the health tech startups in the ecosystem. And what has also been an interesting trend for us is that we see that beyond Singapore, the health tech ecosystem in our neighboring countries are also accelerating. And what has been interesting for Singapore is that these players often come to Singapore as these health tech companies mature. They come to Singapore to raise later rounds of investment, whether Series B and others. And they also come to Singapore as a way to a stepping stone into the broader Asia Pacific market. So at the bottom there, we've also characterized that we have about 60 unique investors and a healthy group of accelerators and incubators that are specifically focusing on health tech and are partners in growing this very diverse and vibrant health tech ecosystem. Next slide, please, Anna. And this is just a snapshot of some of the headlines that we've seen over the last 2 years. A lot of different fundraisers by health tech companies of different maturity levels. You can see some of them are in the seed rounds, in the funding range of less than $1 million. And then you see some of the more established ones, such as Bioformis that's reaching Series C, Holmas that netted a $21.5 million in the Series A round. So we're all very excited about this growing vibrant ecosystem that is witnessed by some of these headlines. Next slide, please, Anna. And then now that we are currently in the COVID pandemic, and that's partly why we are virtual and speaking to you on Zoom, but just to highlight how the COVID situation has actually accelerated a lot of the health tech innovation in Singapore. And this extends across 3 main areas, from contact tracing, the ability to deploy Bluetooth technology to do a lot of the contact tracing, particularly in the early part of the pandemic. Telehealth, in terms of being able to access healthcare such that you might not expose yourself inadvertently to other viruses when you go to see the doctor, and being able to receive medical care through a telehealth provider, to remote monitoring of vital signs, whether it's Bioformis with their analytics of about 20 physiological signals that they partnered with the Ministry of Health, as well as Respiratory in terms of remote monitoring of respiratory data using wearable sensors. So this is just a snapshot of some of the health tech innovations that have actually enabled Singapore's COVID response. So now I come to the last part of my talk. So, and in terms of an economic agency casting the vision for the health tech ecosystem in Singapore, what is our view to this? So for the next slide, please, Anna. So we envision a self-sustaining ecosystem with global ambition. We hope that Singapore would really be a hub to be able to grow the health tech ecosystem. And we see this as an interplay between many different stakeholders in our ecosystem. They could include the Singapore government on the bottom left side of the Pentagon, providers of capital, and providers of capital actually play a very important role, not just in terms of providing the capital itself, but being able to provide the networks, being able to provide entrepreneurs with advice for how to scale, how to reach the different hurdles along the critical path of a startup journey. So I think they are extremely important and a part of the ecosystem that we want to grow. The startups, which are self-explanatory, but beyond that, the large corporates. And increasingly, we see large corporates, many of them EDB clients, coming up with open innovation platforms, pushing out problem statements and seeking to engage with startups to be able to solve some of these problem statements. And then lastly, the healthcare institutions, which really are sometimes the owners of some of the data that's required for some of this innovation, but also I think some of the eventual adopters and customers for some of the innovations that are brought up by the health tech ecosystem. Next slide, please, Anna. So in terms of thinking about that vision that we're casting, what are some of the key ingredients that we need to be able to ensure that we have in this mixing bowl to create this ecosystem? And I think we've identified 4 of them here. I'll go in a clockwise manner, starting from the yellow box, which is regulation. So our HSA is a well-respected regional regulatory thought leader. And the Ministry of Health actually has recently, in the past couple of years, set up a regulatory sandbox to pilot new and innovative healthcare models, such as telehealth. And I think this is really important because as a regulator, I guess oftentimes you wonder if a new approach to healthcare or a new intervention would actually create value, or would it, and most importantly, I think as a regulator, does it safeguard public health? Are people any worse off by going onto a virtual platform to engage a doctor versus going to see their GP in person? So some of these questions through a regulatory sandbox, once we get a certain idea about the value that these technologies create, this really is a proof of value, proof of concept that the company can take from these sandboxes into the region as part of their regionalization activity. A second very key ingredient for us is talent. And here, the type of talent that we're thinking about for health tech is quite unique, because we are thinking about people who are able to understand the biomedical health area, as well as people who are able to handle data and understand more of the AI, ML, and other competencies. And it's really, I think, an interesting area to be in. And how do we grow a cadre of such individuals? Do we take medical students and teach them tech? Do we take tech students, teach them medical and biomedical concepts? So I think that's an interesting conversation, but this really is an area that we think about all the different training vehicles, whether it's industry-led, as indicated here, or whether it's a institute of higher learning-led, whether the universities or some of the other tertiary education institutions. There's also highlighted here the AISG Training Fund for healthcare. And I think beyond just the tech and the healthcare talent, there's also an increasing awareness that we need to have all these adjacent disciplines like health economics, for example, demonstrating the value in terms of the outcomes that we see. Are we able to ensure that we have that cadre of individuals that will bolster the health tech sector? So thirdly is infrastructure, and this I think is mainly around data. And if I may just take infrastructure and reputation together, I think a big part of Singapore and how we think about healthcare data is we need to ensure that healthcare data, if used for innovation purposes, is actually very securely and well governed in terms of the way that it's handled and accessed. And this is a bit of a tricky problem, but at the same time, it's a differentiator because it ensures that companies that come to Singapore potentially as a sandbox, as a test bed, are very assured that the data that they access is actually well governed and has all the right ethical frameworks associated with it. So I think this is a part of how we think about all these 4 ingredients: regulation, talent, infrastructure, and reputation, coming together to help us accelerate the health tech ecosystem growth in Singapore. Next slide, please, Anna, and that's actually my last slide. So as we talk about the key ingredients and that vision for Singapore to be a hub for the region and globally for health tech, we thought more carefully about where we could potentially play in this area. So we think that we could potentially be a platform where we would aggregate innovators, the health tech innovators who are the owners of technologies and creators of technologies, alongside the demand drivers, whether this is the public or private sector with needs and problem statements. Can we bring them together in Singapore, run through proof of concept pilot and maybe the initial commercial rollout, and through this be able to access global markets as well as the domestic market, both in terms of public and private adoption. And this would be supported by external innovation partners, whether it's the large corporates, accelerators, and incubators, public agencies like the Singapore EDB and our partners, R&D institutes and universities. And underpinning all that, I guess, is some of the ingredients that we had talked about, but in particular highlighted here is the strong healthcare ecosystem, the ability to garner data and outcomes, as well as a tech talent that would be able to power this engine in Singapore. Yeah, so in sum, that's kind of the vision that we have for health tech in Singapore, the key ingredients that will accelerate it. And we see Singapore as a hub for the region and beyond for health tech solutions creation as well as scaling. So thank you very much. To my last slide, it's a thank you slide, and happy to take any questions.
Thank you so much, Lisa. It was amazing. It was indeed a great walkthrough to what Singapore is, its strength, and the capabilities that are already in-house, let's say. I would take the chance to, we have still 5 minutes, I would take the chance to ask you a question. We understand a bit, and it was clearly explained from the slide, that the structure of the structure that the EDB is adopting. Would you walk us through in terms of what are some of the programs that are available, be it either for startups to help startups, be it for innovation partners, be it for large corporates?
So there are various, actually it's an ongoing curation process because this area is so dynamic, so new initiatives are coming up all the time. But I would actually maybe type in the chat box Nathaniel's email, because I think he would be that one-stop shop for any health tech questions that you might have. But in a nutshell, there are some platforms out there. For example, we have the Open Innovation Platform, which is a partnership that EDB has launched with various people, various agencies in Singapore, including SG Innovate and others, where we aggregate some of these problem statements alongside some of the innovators with potential solutions for that. So I think that in particular is a platform that might potentially be very interesting for the health tech ecosystem. There are various talent programs as highlighted previously, but these, I think I hesitate to talk about them broadly because they tend to be quite bespoke. And depending on what you talk about, whether it's real world evidence, whether it's health economics, whether it's tech talent, UI, UX type of talent, I think depending on what you're looking for, the responses and available platforms will be quite different. Yeah. Great.
No, I invite the people who are interested on the topic to go and search a bit on EDB's website. I think there are a lot of resources to take leverage on. There are two questions from from our Q&A function. Let's go through them quickly. The first one is from Basel. It will be great to learn if regulatory is support. Well, let me just read it first. If regulatory support and ease the availability of such solutions. Based on my interpretation of the questions, he or she wants to know if there is any regulatory support to ease the adoption of solutions.
Sorry, Anna, I'm a little bit...
Would you be able to cover the regulatory patterns and programs that the EDB or wider Ministry of Health has put into the table to help the adoption of digital health solutions?
Yeah, so here Basil is asking about regulatory programs, or
like what kind of pathways or help is given to ease the availability for such solutions.
The availability of regulatory support for such solutions.
Yes.
It is okay. So I think actually, I mean, the Ministry of Health and HSA, they do, I mean, their mandate is not really to ease the availability of support for companies, but their main mandate is to safeguard public health. So I think it is more opportunistic, and an example that I covered in the presentation was, for example, the regulatory sandbox for telemedicine. So the regulatory for sandbox for telemedicine was something that was born out of the Ministry of Health because there was a need to answer the question of whether or not telehealth is able to provide healthcare services in a manner that's similar to being able to see a physician face to face. Yeah, so I think it was that driving public health need that caused them to do that sandbox, and where that sandbox is, then I think the ability to take the data from that sandbox, and various telemedicine companies have benefited from taking that data to the regional regulators to say that this is a proof of value that the platform I've built actually aids in healthcare provision. So I think that would be more of what is possible in terms of regulatory sandboxes and the ability to accelerate proof of value for some of these health tech innovations. Yeah.
Thank you, Lisa. I definitely invite Basil to check the materials on the Ministry of Health in this case, or EHS, you know, the technological side of the more technological agency within MOH. There is a clarification. Data privacy and medical data is tough approach in Asia. Well, yeah. I don't know if you would comment on the data privacy and especially the medical data, the EHR's approach taken in Singapore.
Yeah, I mean, so I'm not so sure that it's any tougher than other places which have other venues around the world, which are also very protective of data privacy. And I think there are ongoing efforts at the Ministry of Health to look at how we can appropriately anonymize and ensure protection of patient privacy and enable that data to be made available for innovation efforts. And I think actually the current COVID situation has very clearly demonstrated how healthcare data can, if available, can be rendered to advise policy decisions. And I think it's quite interesting to see how policy has rapidly evolved, particularly, for example, if you look at the severe disease rate for COVID in view of a vaccinated population, how that has then changed the policy decisions that are made.
Definitely, yeah. I totally agree with you, especially on if I think of Europe, for example, also there, the data privacy laws are quite rigid. So I wouldn't put Asia as a standout when it comes to data privacy or medical data in this case. Okay, that's fantastic. We have run out of time. So Lisa, I want to thank you so much for the availability today. It was a great presentation. For the people who still have questions, just keep on coming, and we will try to triage them to the right people and give you an appropriate and pondered answer. Lisa, thank you so much for your time. Take care and speak soon in other occasions at this point.
Thank you, Hannah. Thank you, Dario. I wanted to also indicate, that I had included Nat's email. So he is always happy to chat with any health tech company. So his email is in there. Please, ping him if you like. Thank you.
That's great. Thanks for the help. Bye, Lisa. Take care.